Welcome to Pharmative Live. I'm Dr. James Partyka. I'm your host of Pharmative Live. I'm a research scientist and clinical pharmacist and the founder of Pharmative. Pharmative is all about providing practical information with regards to medications and your healthcare information and needs to relay to you healthcare news and insights. And this is our opportunity to have an interactive time. So please feel free to text me your messages or send your questions to info@pharmative.com. And we're coming to you live from our digital recording studios here in Palm Springs, California. And it's always a wonderful opportunity on Sunday mornings. I always say, eat some pancakes, say a prayer, and join us and love Pharmative Live here at 10:55 a.m. Pacific Coast time. So today we're going to be talking about delivering medications to COVID-19 patients. But before we do, I always have a couple of announcements. So here are our announcements today. The first and foremost, I'm going to ask you all to download our easy-to-use PNN Plus Health mobile app, which not only has great news and entertainment, but has a number of vital health resource tools that I think you and your loved ones will benefit from. Okay, so I'm just going to show you how easy it is to use. You can get this from your Android and Apple app stores. If you just go to Dance and Workout Music, just press the tab, press the play button, and we've got some great high beat music that is not only great for dancing to relieve your stress, but it's also great for working out music as well. In addition to that, we have a retro TV program station. We have cartoon TV network station. We have films from the past that you might enjoy. I think I enjoy many of them, and I think you will too. But we also have a number of healthcare resource tools that I think you will enjoy as well. First and foremost is Pharmative Live, as well as Pharmative, Ask Pharmative. And then we have some tools and tabs that come directly from the National Cancer Institute, as well as from the National Institute of Health, CDC, as well as the FDA. And today I would like to just point out to you, if you go to your virtual pharmacy tab, okay, just hit that, and all of the FDA-approved medications are there for you with their indications, their side effect profile, the dosages that you should be on. But they also have a very interesting tool for drug interactions. You just press that, and you would enter medications, press add, enter another medication, press add, and then hit check for interactions. And a family friend last week unfortunately collapsed, and I worked with my family friends to get a list of their medications, entered them directly into this drug interaction checker. And what you want to look for are major drug interactions, first and foremost. We identified the major drug interaction related to our friend, who related to the prescriber. Medications were changed, and it's likely that they had a drug interaction which made them pass out and collapse and had to go to the emergency room. So I think I'm going to ask everyone today who's listening to this broadcast, download your PNN Plus Health mobile app today, check out the virtual pharmacy, check out drug interactions, enter your drug list into here, including over-the-counter medications, and see if you have a major drug interaction. If you do, you want to go to your prescriber and ask them about it, or you want to go to your pharmacist and ask them about it, because even though you might not be experiencing the drug interaction today, that doesn't mean that in the future you won't. So do that today. That's your homework assignment for today. and that is our PNN Plus mobile app. Not only does it deliver great healthcare news and information to you 24/7 on demand, but it also has great music, great entertainment, a great video, TV, and cartoon station, also with a number of great films that you'll find and enjoy and learn and take the time, since many of us are working from home or are not working, how to stream it to your flat screen or how to stream it to your car radio. And you'll find it to be a nice way to take away some of the stress and escape from all of the things that we're dealing with today from COVID-19. I see a number of people out there, including Jimmy, Doreen, and Denise. So I say hello and shout out to all of you today. We're going to be talking about delivering medications to COVID-19 patients. So, a lot has happened since we had our first report on March 1st. Remember, I was talking to you from Sacramento, California, and at that time, the first death from COVID-19 in the United States was reported from Washington State. And it was only on December 31st where the first case was reported from Wuhan, China. And now we find ourselves with over 312,000 cases in the United States and over 8,500 U.S. deaths. So that's a very startling statistic. It's really not something I want to report to all of you today, but that's the reality, and those are the facts. And what we've learned since then is the importance of social distancing and listening to our local and state officials, and basically following their guidelines. And in most parts of the United States, we stay at home and we stay 6 feet apart. And that's the best way we can do to mitigate the cases, the number of cases, and mitigate the deaths. Okay. So before we talk about today's topic, I also want to recap on treatments. Currently, there are no approved vaccines for the treatment of COVID-19, but there are clinical trials that have started enrolling patients. Secondly, there are no treatments approved for the treatment of COVID-19. There are studies that are underway. But to this date, there are only anecdotal reports of what might be effective or not, and some of these medications can be harmful as well. So that's why we look to the clinical trials that are underway, the phase 2 and the phase 3 data that will emerge over the next 6 months to a year in order to figure out what antiviral treatments are available to treat this very contagious and very deadly virus. It's important to remember that hydroxychloroquine, which is oftentimes in the lay press and oftentimes in the political social media, has not been proven to be effective against the virus. And again, there are small numbers of patients on studies, anecdotal reports, possible efficacy. However, we know there's a lot of toxicities associated with it. Predominantly, it is cardiotoxic in some patients. So, again, we have to take all of that and weigh the benefits versus the risks. And right now, there's no clear benefit. There are clinical trials underway. There is an emergency access protocol that is approved. Hydroxychloroquine is an agent which is FDA approved for malaria. It's also approved for rheumatoid arthritis and lupus. However, again, we do know that there are a number of serious side effects associated with it. Low blood pressure, nausea and vomiting, hearing loss, eye toxicity, as well as cardiotoxicity. So it can change the arrhythmias of the heart. So that's why any patient that has COVID-19, we need to weigh the benefits versus the risks. We need them to be on a clinical trial or on a national emergency protocol, and we need to understand the efficacy. As of now, the published data is very scarce, and there's a lot of problems that when interpreting the data, limits our ability to really appreciate if it improves patient outcomes. And by improving patient outcomes with hydroxychloroquine, I mean time to improvement, time off the ventilator, reduction in mortality rates. And those have not been demonstrated at all. There are studies that demonstrate a reduction in viral load, but again, hydroxychloroquine, any usage of it would be off-label and again, considered to be experimental. So that's just, it never can be say enough about using medications for their approved indications versus off-label versus on a clinical trial. The best scenario would be for any person in a hospital who has COVID-19 to be on a clinical trial, because those are reviewed very closely by the institutional review boards, by the FDA, to make sure they're of sound science and to make sure we have the safety in perspective with what we're trying to determine from the clinical trial. What's of interest lately has been the use of plasma therapy, which has been around for over a century. And in this case, those COVID-19 patients that have recovered, those COVID-19 positive patients have turned negative and are beyond 14 days, have antibodies for the virus. So they donate their blood. There's a national protocol available to do this through the Red Cross. And they donate their blood, and then it's processed, and the plasma can be given to certain patients who are seriously ill with COVID-19. The hope is that the antibodies that are present in the plasma can be used to treat the disease. And that's of significant hope, but again, it's highly experimental. So that's where we stand with regards to the treatment. And again, I'm just going to summarize again. There are no proven efficacious treatments for COVID-19 as of today. And there are no proven vaccines for the treatment of COVID-19 today. Those patients that are looking for treatment and hope should look for a clinical trial. And if you go to clinicaltrials.gov, which you can also go through your PNN mobile app, you might be able to find a clinical trial near you to participate in such a trial in order for us to be able to obtain scientific information regarding the treatment of disease. So that's where we stand today with regards to the treatment and the prevention of COVID-19 patients. Now we're going to talk a little bit about the distribution of medications for COVID-19 patients, because this is also becoming a problem throughout the world. And after we discuss this short segment, I'm going to have a special word for you out there, and that's my tease for you to stay online today. Okay, so there are a number of medications that are in short supply for not only the treatment in experimental clinical trials or special protocols, compassionate use, but also in the supportive care management of patients that require ICU intensive medication. So we have, not only do we have a shortage of medications, but as you all know, a shortage of ventilators, PPEs, and shortage of COVID-19 tests. And we still have that today. We had that on our very first report on March 1st from Sacramento. Hopefully that is getting resolved, but still states and large cities are struggling with shortages all over and across the board. Now we're going to focus on medications, right? Medications are important in a supportive care measure to relieve pain and to improve comfort levels for any patient that requires a ventilator or intensive pulmonary care. Because as we know, the virus comes in through our mouth, nose, and eyes, and then it kind of works its way to the throat, and then it works its way to the lungs, and it produces thick mucus secretions, which clogs up the lungs, and that diminishes the oxygen exchange from breathing to your blood. So those are the patients when they have difficulty in breathing, shortness of breath. Those are the patients that need to go on ventilators when their oxygenation levels drop dramatically in order to ensure that they could survive the virus. And because of that, they require special medications. And those medications include everything from sedatives, anesthetics, painkillers, and muscle relaxants. And that's all to, again, improve an efficient exchange of oxygen from the lungs to the blood and to keep the patient comfortable. And according to the American Society of Health System Pharmacists, there has been a 51% increase in demand for these medications, and there has been a 63% decrease in fill rate. Now, what do I mean by fill rate? That's the distribution rate from the manufacturers to the hospitals. Okay, so we have an increase in demand and a decrease in the rate of distribution rate and decrease in supply. And why is that? Many of these drugs are off patent, and they're being manufactured by generic manufacturers. And a good example of this would be vecuronium. Vecuronium is a neuromuscular blocker, which is often used for patients that are on ventilators. The manufacturer that developed the drug is no longer marketing the drug's off patent. So a generic manufacturer is producing the drug, but unfortunately they produce the drug off-seas, outside of the country, and there's been a short supply of the drug coming from countries like China and India into this country as well. So when this happens, there has to be societies like ASHP that work with the FDA to track, again, drug shipments, and again, to notify the drug suppliers and work with the hospitals and the pharmacies to be able to, again, supply these drugs or look for alternative drugs which can be used instead of the drugs that are in short supply. This happens routinely throughout the country. It's just now becoming very visible and of concern because of the epidemic, the pandemic that we're all dealing with regard to COVID-19 patients. Oftentimes, sometimes natural disasters can create a decrease in drug supplies, depending again where these drugs are being manufactured. Often, these drugs are manufactured in the United States, but oftentimes they're also manufactured in other countries throughout the world. So it's a complicated drug distribution system. Not only do the pharmacies and the FDA have to track regular drugs, but we also have to track controlled substances and so forth. And there's a great deal of regulation. There's a great deal of regulation over the manufacturing of drugs as well. In addition to that, your pharmacists throughout the country, whether that be hospital pharmacists or nuclear pharmacists or infectious disease pharmacists, oncology pharmacists or community pharmacists, they work to making sure that the drug is available, but they also have to do special compounding of certain drugs. A good example of this would be taking hydroxychloroquine, which comes in the form of tablets. And for those patients that cannot swallow tablets, they have to be made into a slurry or a syrup by compounding the tablets into, by levigating the tablets and by placing certain excipients into the mortar and pestle to generate a slurry or a syrup so that they can go down more easily. And this happens not only for the elderly, but also for patients that have difficulty in swallowing tablets or for pediatric population as well. So there's a great deal that goes into all medications that are dispensed, obtaining the drugs through our distribution system in the United States, as well as through our community pharmacies. Or to take note, as of today, there's been a great deal of shortages for thermometers, distilled water for breathing machines, vitamins, minerals such as zinc, over-the-counter medications for decreasing fevers, as well as for prescription medications. So again, get to know your pharmacist, whether that be your community pharmacist, your hospital pharmacist, your clinical pharmacist, and they can help you in making sure that you're supplied with the medications that are necessary to maintain your health and treat your disease. And call ahead, and oftentimes many pharmacies will have delivery services as well for those patients that need their medications as soon as possible. So that's our topic for today, and now I'm going to conclude with a special word. And it's something that I've been thinking about lately. Many of us are not working because we've either been laid off or our jobs are no longer needed because of the closing down of many workplaces because of the regulations associated with dealing with this epidemic. And so we have some extra time at home, and I think it's a good opportunity for us to take a negative and make it into a positive. And first and foremost is strengthening our relationships with our family and our friends and our neighbors, and strengthening those relationships in our community. But it's also a good opportunity for us to not only take care of our health by searching for ways of which we can reduce our anxiety levels or improve our sleep. There's many apps out there, but even if you go onto YouTube, you can find many free channel stations out there of programs that allow you to, again, relax and reduce your stress levels. We can use exercise at home. Maybe this is a time where we can turn our garage by having some floor mats and some weights and using it, or a stationary bicycle, to use it to improve our exercise and keep our weight down, reduce our anxiety levels by meditation and using meditation apps. But it's also a time where we can use it to improve our skill sets. So those people out there that want to learn how to cook better, there are many cooking lessons that are available online, some of which are free, some of which you pay for. And again, check YouTube out first, because there's so much available for free on YouTube. I highly recommend that. Or skill sets. Those people that want to get better at graphic design, better at sewing, those people that want to improve their artistic talents by learning how to draw or paint. And there's so many things that we can do to improve our skill sets, follow our passions, our talent, and do things and improve levels of our abilities beyond belief. So we have a neighbor down the street from where we live in Palm Springs, and he's making surgical masks. And we have another neighbor out there that's involved in a delivery service. And so this may be the opportunity that you're seeking for to not only improve your skill sets, but also maybe develop your home business. There are many new opportunities for developing home businesses, such as, again, delivery services, or again, sewing face coverings, pursuing art, or even pursuing your own video show right here online. And the whole purpose of this would be just improving ourselves and getting better and getting stronger. So when that corporation calls you, you might say, no, I think I'm going to work for myself. I'm making quite a bit of money on my own right now with my own home business or my own home family business. Or if you want me back to work for the company or the corporation, it's going to be on your terms, and it's going to be at your higher rate of wages. And so that's my special word for all of you today. Take this opportunity to improve ourselves, strengthen ourselves, keep ourselves healthy, practice social distancing, keep 6 feet apart from each other so that we can get through this epidemic, so that we can move on to a much better and healthier lifestyle. So that's all we have today for Pharmative live. I thank you for being here. In the meantime, stay healthy, because it's easier to prevent disease than it is to treat disease. And I'll see you next week. Take care.